important that we all learn from nature. In this zoonosis, bats are the main reservoir host, and they get a very mild form of disease, and quite often it is just asymptomatic for them. But for humans, it is much worse. It is a lethal disease in humans, and so we must look at the differences and learn from nature. We're able to block the COVID-19 infection cycle, and this is very good news because it's potentially home preventive management areas, and for health and safety we need to do it. To stop the pandemic we need to do it. We need to prevent lockdowns. We need to rescue our economy and clean our environmental air. The infective dose is affected by various things, and this differs in the bats, and bats are unable to change why they are less affected by the virus, and we who are worst affected are able to change. So we need to look at what the differences are and see what is affecting the infective doses which we're inhaling. Less frequent inhalations occur in bees' flight, because when bees are flying, they are flying into uncontaminated air, and the air is passing over their nose very rapidly. There will be pockets in the air where there will be an infective dose, but they're flying through it too quickly to catch an infective dose or to catch a lethal infective dose. They must catch the infective dose somehow. We don't know what that is yet, but they are unlikely to catch it as frequently as we are. We also have flight, and it is through aviation that we have spread it around the world to the bats. It's not the bats' flight which has done it, it's our aviation which has turned it into a pandemic, and is quickly, far quicker than bats can fly. So, and also there are advantages in bats in that they sleep upside down. In sleeping upside down, their nose is facing downwards, gravity pulls on the virus out of it, and that's the opposite to us. We're standing upright most of the day when we're working, and bats sleep during the day, and while we are working, the virus is being pulled down by gravity into the lower parts of our lungs, and this is shown in some of the earlier x-rays, and other techniques are showing it lower down. But bats also have the gravity advantage in that they're hanging by their feet when they are asleep at night, and this is like carrying a plastic bag. The bag sides hold together, and so the whole of their abdomen and chest and everything is all pulled together as they're hanging like that. That means there's a pressure on, as well as the gravity pull, on all the abdominal contents, on the diaphragm and the respiratory system as well. So when they expire, they get a really good expiration, with most of the things going out, leaving a very little expiratory dead space left, whereas we have a much bigger dead space left after we've expired, and we're much bigger than them, so we have a much longer bronchial tree. So there are things which we can change, and there's nothing which the virus can change. The virus is dependent upon just being wafted along by the air as to where it goes. It can evolve, but it doesn't have any control over that. And the bats, similarly, they have evolved to be what they are, and they have no control over it. But evolution, viruses play an important part in evolution, and has played an important part of our evolution of intelligence as well. And we're able to use our intelligence. We know lockdowns work, so we can do lockdowns. It decreases the frequency of infections. The dead space, which is expired from endogenous water. Now, all compounds produce what is called a gram molecular volume. the gram molecular weight of, for example, water is 18 grams, which is about 4 teaspoonfuls, and it produces, when it's turned from the liquid into the gas form, 22.4 litres. So going from 4 teaspoons to 22.4 litres is a big step up in volume. Now, by no means all the air which we expire is from water. We need to drink plenty of water, particularly if we're in a dry environment or using a dehumidifier. And if we are hydrated, though, some of that water will go into being expired. Some of it will go in all the other ways in which we expire water: urination, defecation, and expiration. But quite a large volume will be continuing throughout inspiration and expiration. And this is not only of water, this is also of the other things which are present, like formaldehyde is added by bakers to bread, and that's a solid when it's added, so that produces a considerable amount which we can detect by various monitors. And also the things which monitors show is called the total volatile organic compounds. Now, that reading would probably have viruses in it as well, although the main portion of that is probably water in my cells and compounds such as that. So this gram molecular volume, which we're expiring, continues whether we're inspiring or expiring. And it's also the virus in both cases has to work against it. In us, it has the advantage of gravity against it, but in the bats, it has the disadvantage of having to work against gravity in order to get in. So bats have definite advantages over us, and we have things which we can do to decrease that. As we know, that it can be increased by the disinhibition of socializing. We all like to have a drink, we all like to be social with other people, and we all like to party. We're entitled to do that. There's nothing wrong with that, except it is exactly what causes the spread, and disinhibition means we probably don't obey the rules which we should be obeying to prevent the virus from spreading. In gravity, I've mentioned the size of the bronchial tree, already mentioned dehydration is essential that we do not become dehydrated. But dehydration of the air around us with dehumidifiers is one way of decreasing infective dose, and it can do that enormously. It's a very powerful way of decreasing infective doses. So decreased doses can be sterilizing of air spaces, home ownership. People who own their own homes tend to look after the people who live in them because they're their loved ones, and they tend to spend a bit more money on providing dehumidifiers and various things which are more healthy. So home ownership is one of the things which decreases the infection. Passage of sterile air over face. We can have a little fan, which is like the bats is having it blown over their face. We can create that. We've got control over doing that. A little fan doesn't cost very much, and dehumidifying is also the most cheapest way in order to purify the air. Reinfection then is prevented. And then there are mouthwash and virucides used in mouthwash as well as fluoride. Those we seem to be using, and we don't seem to be getting, as a consequence of that, the mouth and the nasopharynx being infected as much as we would if they weren't being used. Here's a diagram of all of what I've said, but in just a little bit more picturesque and easier to look at. The airway and is where the infection starts and reinfection occurs. The nose, the mouth, the pharynx and the larynx, those four areas all have ACE inhibitor sites and can be sterilized by virucidal mouthwashes, but must be spat out and not consumed. They cannot be consumed. They're not licensed for that. And if you swallow them, they have things in them which are toxic, and that will make your problems worse and not better. The trachea, bronchioles, all do not have ACE inhibitor sites, and there are very few in the larynx. So there you mainly are dependent upon the gram molecular volume of expired air constituents to help waft the virus out, as it does in the bats, but in us the virus is drawn by gravity through that down to the sites. So we are disadvantaged even by the length and size and diameters of our trachea, bronchi and bronchiole as part of the dead space. And the alveoli, well, here is where the infection starts. It starts at the type 2 pneumocytes on the ACE inhibitor site. Now that inhibitor site, as we know in the mouthwash, there are things which can be done to decrease it, and that is where we are tending to go on the spike protein, antigens, and a vaccine developing around that. Now, coconut cream people say is good for them, and lots of people take it, but not in large quantities. Don't go taking large quantities of it, because it's possible that it affects at this side as well. Certainly it goes throughout the body, so when you've had a few teaspoons full of it, you see changes in your skin. If you've got dry skin, as I have, you see it becomes oily fairly quickly. So coconut oil might have a role to play here, but people haven't actually shown anything about that yet. Viral replication, as we know, takes a period of time. And during that period of time, we see that as the asymptomatic phase. There are 3 asymptomatic phases. One is where the person never becomes symptomatic, so it's just a subclinical infection. And then there's a pre-symptomatic asymptomatic phase as well, and then there's a post-symptomatic phase. All of these 3 phases, there is known now that they can be infective. So because a person is not actually in the symptomatic phase, it does not mean that they're infective. That means that there's a lot of time, because we breathe in very rapidly, 15 times a minute. That is 900 times an hour and 21,600 times in a day of 24 hours. And over a 10-day asymptomatic phase, it could be as much as 216,000 inhalations and exhalations. And that is a lot of opportunity for infection to occur. And the problem with this virus is that it is lethal. And it is lethal because people catch a lethal dose, and people who have things wrong with the immune system are not functioning properly, and comorbidities. So we have to try and make sure that we prevent reinfections. Reinfections occur at the home, so it's in the home that we must try and prevent all of this. So here we've talked about expiration, inspiration, the trachea and the bronchi, and that in the dead space, it is mainly the gram molecular volume which is going to be important, and this can be huge. You can do the calculations which we've done here, and theoretically you could produce almost as much volume as we're breathing in, but that doesn't occur because we obviously excreting most of these substances as different things. And it's not just the water that's gram molecular volume, it's that of the formaldehyde gram molecular volume, and all the constituents of the carbohydrate which you're eating, which gets broken down into carbon dioxide, which is a gram molecular volume, and water from the carbohydrate, which is a gram molecular volume in addition as well. So gram molecular volume is very important in this whole management of this pandemic, and it is best managed at home because that is where we can prevent the reinfections. Attachment to the type 2 pneumocyte, well, this, as we've already said, could possibly be affected by various things which are hydrophobic soap, similar to surfactant, and but we haven't shown that surfactant makes a difference. In fact, the Chinese, when they did their first things, found that addition of surfactant didn't make a difference. So it is probably not too likely that coconut oil would make a difference, because it's mainly going to make a difference because of its surfactant effect, if it does make a difference. On entering the pneumocyte, the viral replication begins. And when it is replicating, people used to say, well, it just needs to, it's got the RNA structure there, just needs to use the RNA structure and produce lots of viruses. That's not altogether correct, because everything, all these building blocks are not there. So it's got to break down the things which have got them, and salvage pathways which are already in the cell. It's got to import some through the nutritional and the blood transfer to the alveolus, and it's got to have them which it can turn into new virus particles. And part of that, you've got the one carbon cycle, which dependent on folic acid is limiting. We know that in pregnancy we supplement with folic acid because it is limiting. And we know that now in all cells can be turned into formaldehyde. Formaldehyde is carcinogenic, and it is excreted by being blown out in the air. So whatever the maker has put in grams, 22 times 4 per molecular weight of litres, will be being expired as formaldehyde. And you can do this with a monitor in a plastic bag. Put your slice of bread in it, and you'll see it comes up to maximum readings on the monitor very quickly. So we need to select what we're eating. We need to monitor and look at what we are expiring as well. If we're expiring increased formaldehyde, it could be for various reasons. It could be from your diet, it could be that you've got something which is replicating. That might be a malignancy cell, that might be a ordinary RNA virus, which is not going to affect you very much, or even a DNA virus, which is not COVID-19, or it could be COVID-19. If it's COVID-19, you need to self-isolate. So if you're testing yourself and your breath and blowing onto these monitors, as I've shown in previous videos, and if you can show that that's raised, then you need to get people to come and test you properly. Certainly don't go out. You may be infected, and wait until you're shown that you're not infected before you go out. It's the same, you need to self-isolate and not go out. And cell death. Cell death is also decrease the amount of surfactant, but as I already mentioned, surfactant doesn't seem to play too much of a role, but it will play a role in that if there is surfactant around, the alveoli can all open up. And if they're opening up, then they're more available for other viruses to infect them. And so there's a balance between it being better or worse. And so the net is it doesn't have an effect, but ultimately we do need surfactant to be healthy. And as many as 216,000 breaths in a day during the asymptomatic phase means that there is a lot of opportunity for alveoli, if they're open, to become reinfected. And this we can stop by dehumidifying air and sterilizing the air. Vaccines are an astounding achievement, and preventive medicines, the number of lives which they have saved is uncountable. And we do that as soon as we can in all newborns, and we follow them up throughout their life in general practice. with various vaccines. Even I just recently had my flu vaccine. So vaccines are very, very important, and we do need to praise all the efforts which have gone in to produce them and be very grateful that we're getting them, because they will make a huge difference. But they are not the end game. The end game, if we want an end game, HIV people who've caught it have still got it. They've produced vaccines, the virus has just mutated and tolerant of the vaccines. Ebola, very much the same. We haven't eliminated Ebola, we haven't got a vaccine which is eliminated. Viral hemorrhagic fever is exactly the same, and they are very lethal. So there are far more rapidly lethal viruses which can and will evolve, which we've got to look out for. And if it takes us as long as it does, which is a very short period of time to produce a vaccine within a year, but if it's going to take us a year and we then already produced another virus which is mutated, which may not be susceptible to it, vaccines are going to have their problems, but they are essential. We're going to always need them, and we need to find alternatives so that we can treat this things which we haven't been able to treat during this first year. All these millions of deaths throughout the world that have occurred in this first year, we must make sure they do not occur in any viral replications in future. I addressed the World Police Medical Officers Conference in Dunblane, Scotland, 15 years ago, and I warned about it then. I was talking about biocrimes. There hasn't been anything invented by man which hasn't been used for both peace and for war. So, and criminals will use things to their benefit. So we have to make sure and treat it as a war. We've got to treat it that it's a war against the virus, not against the people. We've got to make sure people learn to live without wars, and we need to make sure that that can be done. Our wars are things which we shouldn't be having at this stage in our evolution. If we're going to be having wars at this stage of our evolution, when we move out into space, we're going to take wars with us. So we need to learn on our planet now how to get away without wars. And to treat the virus, we've got to wash and clean our polluted atmosphere. If we don't look after the atmosphere on our planet, evolution of viruses will continue. And we have to make sure that we now have an emphasis on global cooling and not be shouting about global warming. Nobody seems to be listening to global warming. We must tell them we've got to start global cooling immediately. Symptomatic phase, well, that is diagnosis, and that's fairly easily made by the symptoms which you all know. The cough is the main one, and the temperature, and not feeling well. So as long as the symptom phase is present, the person is extremely infective. And during that extreme phase of infection, they have to be isolated. And you have to then be monitoring that the respiratory system is not being impaired so much that their oxygen level. Most people now have pulse oximeters in their homes. You need to watch that. If the oxygen is going, or if they've got comorbidities, they need in any case to be reported, but they need to be monitored for that while they're still in the home before they need to go to hospital. When they get to hospitals because of respiratory distress, hospitalisation, intensive care, this must be prevented sooner. Every patient which goes to hospital is a sign that we have not looked after them properly in our own homes. So we've got to do that and prevent that far sooner, and prevent the spread as well at the same time. Death or recovery, possible long COVID, these are all indications that we have failed. I know that people working in ICU and A&E, or when they lose someone, they feel it's their fault, okay? It shouldn't be getting them. We shouldn't be sending that number to them. It's not their fault. They've done their best. And some of those that will have prevented from dying end up with long COVID. So they've at least got something which we can still continue to treat and manage But what we must do is all work together, make sure that we don't be sending these people into hospital. Hospital is an indication that we have failed. We have failed in public health, and we've failed at home as well. And when they're locked down, it's an indication that we are doing it better at home, but we still got to do it a lot better than the way we're doing it now. The way to do that is to sterilize the air as it comes in, waft it past our face, and sterilize it as we expire it. If we do that so that it doesn't come into contact with the space around us, then we can travel on buses and trams and trains and aeroplanes, ships, and go to gyms and things, as long as the air is not getting in where other people can expire it. You can sit side by side in an aeroplane and travel around the world, and aeroplanes, like bats, you can suck the air out very easily. In fact, it will go too fast. You have to control what is being sucked out. You push it into the engine in the front, the jet engine. The virus will be dead by the time it's come out of that heat. But we have to be realistic, but we can do that. We can do it in a home, if we can do it in a room, if we can do it in our 8 cubic meters, we can do it everywhere else. And everywhere else has got to be forced to work together with us if they don't want to. People who own their own homes have usually got enough money to afford it. It's not expensive to run dehumidifiers and to sterilize the water in the dehumidifier by various means, such as UVC, or by even heating it or boiling or cooking it or just throwing it on your garden. It's not going to be infect anybody thrown on the garden. There are too many bacteria and other things which will use it and eat it up, earthworms and what have you. So we all just need to work together. If we all work together, we can solve this problem, and we must do it now. Starting in our homes, then extending out into everybody around us and to our total environment as well. And we've got to do that on an international cooperative basis. Make sure we don't blame one another and turn one another anything into wars. The war is against the virus. The war is not against other people who have probably made mistakes, serious mistakes, maybe even negligence or reckless mistakes. But we need to make sure that we tackle the problem now, and then we need to make sure that people do not make reckless or any type of mistake whatsoever, and that any type of experimentation with bats must be done on an open basis internationally so people know what is going on. Thank you very much. We must all work together, and good luck in doing so. Thank you. Bye.